Welcome back. In this episode, we are looking at another common thing relating to mental health. It comes with various characteristics such as feelings of worry, nervousness, and then fear of overwhelming instances, right? So, while occasionally is normal, I've already mentioned what we are treating in this episode. We are looking at anxiety. Anxiety could be normal sometimes, but when it becomes more than often, it becomes a serious mental health condition that must be given attention. So let's look at some of the types of anxiety. We have the generalized anxiety disorder. This is the commonest types and is the excessive worry about everything in life. Some people worry excessively about everything. The next one is panic disorder. This is also very common. Some people are always scared of coming events. We have also social anxiety disorder. This is most common with the introverts, right? And then we have phobias. We all have our various phobias, the things we are scared of and things we do not want to do. We have post-traumatic disorder as well. This is the type of anxiety that follows after a traumatic event. And then we have obsessive compulsive disorder. This is also common as well. It's just recurring intrusive thoughts and compulsions to perform specific rituals. Yes, and it's very common. So with that being said, let's quickly look at the causes and then some risk factors. It's just like the depression, we have biological factors, environmental and psychological. So with the biological, we're looking at genetics and the brain chemistry, just as we looked at in depression. We have neurotransmitter imbalance as well. That falls under biological factors. We have environmental factors as the second one. There we have stress, trauma, and then significant life changes. And we also have something very, very important under this side. We have substance abuse, drug abuse falls here. Then we have psychological factors, that's the negative thought patterns, low self esteem, and then perfectionism. Let's look at some of the symptoms. We have emotional symptoms, and persistent worry or fear is under this. We have restlessness or irritability, feeling of impending doom. We are always scared of upcoming events or negative outcomes. We have physical symptoms. We have the rapid heartbeat or palpitations, sweating or trembling, nausea, and then abdominal discomfort. Shortness of breath or difficulty in breathing is also a factor. Then we have some behavioral symptoms. That's the avoidance of behaviors, compulsive disorders, and then difficulty concentrating or making things happen. Let's look at some of the treatments you can use in anxiety. I think the most popular treatment option is therapy, seeing a psychologist. This is more of a conversational type of treatment, and this is very, very common. We also have medications that are used. We have the antidepressants, we have beta blockers as well. Then we have anti-anxiety medications. We have lifestyle changes. You can also be advised on your lifestyle so that you make adjustments to suit whatever that is happening to you in order to overcome the problem. And then we have self-help strategies. That is keeping yourself active, practicing relaxation techniques, seeking social support, and then engaging in activities that bring joy and relaxation. Now, let's look at how do you cope with anxiety. You need to identify your triggers and learn how to deal with them. You need to develop coping skills. You should be able to cope with certain situations. You need to seek support, practice self care, and then also be able to challenge the negative narrative. You should always have a positive mindset that will help you overcome many of these problems. And then let's see, when to seek help. You should be able to seek help when this becomes more than often, especially when you have so many episodes of panic attacks. You need to speak with a professional that can assist you to overcome this. And there's also one thing, try as much as possible not to isolate. You have family, you have friends, so try to be conversational sometimes. You shouldn't always keep to yourself. And this is also a way of overcoming some of these mental health challenges. This is also a brief information on anxiety. I hope you enjoyed it. If you did, kindly subscribe to our channel. Drop your comments, like, and then make sure you click on the notification button not to miss our next episode. Thanks once again for being with us, and until next time, stay healthy, stay safe.